Okay, it looks like most folks have joined, so we'll get started. Hi everyone, welcome to the Q&A with Jenny Pachet. My name is Emma Tornaro and I'm a Client Service Coordinator with the Parkinson Association of Alberta, and I'll be moderating this webinar. If you have any questions during the webinar, which we hope that you do, please submit them in the chat below. At the bottom of your screen there's an icon and it says chat, and you can just enter them in there. I'll get the chat started and then you're welcome to just enter your questions as we go. Just a disclaimer, this webinar will be recorded. All of the information provided in the videos by the Parkinson Association and the featured speaker is furnished strictly for educational and entertainment purposes only. The service is not intended to be diagnostic, prescriptive, or replace the relationship, advice, and/or care of your physician. General questions about symptoms, treatment, available medication, complementary or alternative healthcare therapies, and current research will be fielded. And so today we are very excited to welcome Jenny. She's a speech language pathologist and she has been for 20 years. She's worked with adults in acute care, neuro rehab, and long-term rehabilitation. Her areas of expertise include stroke, brain injury, neurodegenerative conditions such as Parkinson's disease, and currently she's working in private practice with clients who have issues with communicating, so speech and swallowing issues. And yeah, we're very excited to welcome you back for another webinar.
Thank you so much, Emma.
So I guess the first question we'll start with is, what is speech language pathology and how can it help with Parkinson's?
Okay, great. Well, speech language pathology, we deal with different areas. So we deal with people's ability to talk and to be understood. So when it comes to Parkinson's disease, it's sort of helping with a very common disorder that occurs called hypokinetic dysarthria, which means that the different subsystems of being able to produce speech are impacted, so causing weakness or incoordination, which can impact their speech, which may impact how well they are able to be understood, so their articulation. It may impact their loudness, how loud they are to be understood. Those are sort of two of the main areas. Another area that we work with is swallowing aspects. So if they've got difficulty chewing, prepping food, swallowing the food, things like that, which can be common features in Parkinson's disease as well. So we sort of evaluate, assess all those things, as well as try and treat them, try and slow the process down, sometimes improve the process, and sort of follow along through all stages.
Okay, great. And so I guess one of the first questions is, when should someone consider visiting a speech language pathologist?
So depending on whether they're having difficulty with speech or swallowing or both, that's a really good time to get in touch with a speech language pathologist. It could be things like having people ask you to repeat. That if people are asking you to, can you say that again? What was that? I didn't hear you. That's sort of an indication that people are having trouble either understanding you because of decreased articulation, or difficulty hearing you because the loudness is a bit decreased. And a problem with Parkinson's disease tends to be difficulty with sensory feedback. The person may feel like they're talking loudly and at a normal level, but people around them are starting to feel like, I can't hear you all that well. So that's a really good indicator speech-wise. From a swallowing perspective, it can be trouble chewing, taking a long time to have meals, coughing throughout a meal, feeling like something gets stuck in your throat, having difficulty chewing harder types of foods, all of those kinds of things, just difficulty not necessarily enjoying food as much because it takes so long to eat a meal. That feeling of trying to swallow, and almost starting the swallow, but not completing it, and then finally feeling like the swallow's been completed. All of those things are sort of indicators that perhaps we could do something to help you out in those areas.
Okay. And I guess commonly we hear from clients that they feel that they're asked to repeat themselves a lot and that they're speaking quite loud and their care partners are saying, I can't hear you. And so I guess if the care partner does get a hearing aid and that still doesn't fix the problem, is that a good indication that maybe it's time to to see a speech language pathologist?
Yeah, like I had one client who that's exactly the argument that him and his wife had. And she said, I went and got a hearing aid. And yeah, it helped a little bit. But once he had treatment and actually was speaking louder, I didn't actually need the hearing aid anymore. So it's a good indicator, but even if it's not the spouse asking to repeat, to pay attention to when you go to the grocery store, to anywhere where you're talking to strangers and they're saying, oh, I'm sorry, can you repeat that? So, because sometimes our own people who we see all the time, we just are like, I always have to repeat myself with you. But it's when, say, the receptionist at the doctor's office is like, I'm sorry, could you tell me your name again? Things like that, where you're kind of paying attention to other people in the community who are asking you to repeat or saying, I didn't quite get that. So we call it intelligibility. How well do we understand what it is that you're saying? Do I understand you 85% of the time, 90% of the time, 50% of the time? Does it feel, some people have what they call palilalia, which they'll say, I feel like I'm stuttering. And so that's another indicator to perhaps see a speech language pathologist, or feeling like they're rushing their speech, that it's starting to quicken up and talking in these short bursts of really rapid speech. That's another good time to be seen.
Okay. And then the next question is, do vocal exercises have to be tailored to the person, or is there certain ones that would benefit anyone with Parkinson's?
Voice is sort of one of those areas in speech pathology that is very specialized. So it's not a one size fits all for everyone. Certain treatments are really good for the majority of people, but we have to know that the reason why your speech is the way it is, or your voice is the way it is due to Parkinson's disease and not to something else. So frequently, ethically, we're supposed to say you should be scoped by an ear, nose, and throat doctor before performing any voice exercises. Because that ear, nose, and throat doctor is looking to see whether you've got a nodule on your vocal cord, and that's what's causing the breathy voice quality, or a paralyzed vocal cord, and that's what's causing the issue. Because if the organic reason can be taken care of, you may not need any other types of treatment. But if it is strictly just because there's weakness at the level of the vocal cords, then we can treat you much better. But certain things will work for some people and not for others. But it's best for, say, for someone like me who deals with Parkinson's disease and someone comes in, I can generally tell if it's because of Parkinson's and not something else. Some of our ear, nose, and throat doctors don't want to see people just to scope them for that. And it's unfortunate because technically, ethically, we kind of need that to happen. But I think even within AHS, they've sort of determined that if a speech pathologist sees you and feels that it's generally from Parkinson's disease, then they'll be able to kind of do a trial and assess and treat. But if there's something that's not quite right, then we kind of say you need to go to the voice clinic. And the voice clinic has sort of usually an ear, nose, and throat doctor, as well as speech pathologists who specialize in voice training. So they're the ones who can provide the best exercises in that case. So yeah, you kind of just can't be like, I found something on the internet, I think I'll try it out, because you may be causing more damage than good.
Right. Okay, thanks. One of the questions here, and I think this is COVID specific, how are you supporting individuals right now? Is it virtual? Are you meeting with clients in person? And what would you need to have ready for your first appointment?
So when it comes to our offices, we do have I do see some people in my office. We tend to use as much of the PPE as we can. It's difficult with a mask that is full-faced kind of thing. So we tend to use face shield, plexiglass, stay as distant as we can for therapy, for sure. There's some people who much prefer virtual, and I see patients that way as well for either consultations or treatment. Some patients I can't see that way, like on my caseload, if I have someone with a stroke, who has difficulty handling computer stuff, it's easier for them to come in. But if it's a Parkinson's patient, you can actually even do the full treatment online. There's ways of doing it online as well. Through Alberta Health Services, I'm not sure what they do because I'm in private practice. I can only speak to sort of what I do. It's worth a phone call to Alberta Health Services to see what they do in each of the places that can offer treatment for Parkinson's disease. So it's kind of, I do a little bit of both. And I think AHS maybe does a little bit of both as well, because they may do some virtual treatment as well. Depending on the type of treatment too, because there's very specific treatments. The gold standard for Parkinson's is usually LSBT Loud or Speak Out, which are very similar programs. It depends what program the speech pathologist is trained in, but that's sort of the gold standard if you're doing the intensive type of treatment. And that is usually for 4 weeks, 2 to 4 times a week, for an hour session. And then there's homework every single day. So it's quite intensive. If you're not doing the full intensive type of program, there's not much you would need ready for your first appointment. It would probably, the first appointment would be more a consultation to see where you're at and whether you would benefit from the big type of treatment or whether there are some tips and tricks that can help you in the meantime. So it's kind of very individual.
Okay. You mentioned the LSBT Loud and the Speak Out programs. Can you maybe just go into a little bit more detail of what they are?
Sure. So the LSBT program stands for the Lee Silverman Voice Treatment. It has sort of been the gold standard. It has the most evidence-based research for its efficacy in treating patients with Parkinson's disease. And it's sort of, the one target for it is loudness. So by learning to speak loud, but with good vocal quality, it sort of has this ability to improve articulation. It decreases speed of speaking. It increases volume, and it sort of increases facial expression too. It sort of hits all the different areas, but it's done in a very systematic way. There's certain activities that you do every day for treatment, and then there are ones that change each week. So we do ahs, which help with loudness. We do high-pitched ahs, low-pitched ahs to help increase the musical quality, the prosody of someone's voice, so that they're not sounding so monotone. It's that mono pitch, having a little more color when they speak. We then work on extending that loudness. So how much effort does it take to produce speech? So it would be sort of at the word level for the first week, sentence level at the second week, paragraphs at the third week, and conversation at the fourth week. So it's a very intensive program. It's sort of like boot camp for the voice. And it really, people show a lot of improvement during that time. Speak Out is very similar. It may just be shorter sessions. They maybe have a little bit different terminology that they use, but it's based on the same idea of this intensity of improving your vocal quality, your loudness, which then impacts the rest of your speech. When you're done that kind of intense program, a lot of them, they kind of have follow-up programs. There's stuff online for follow-ups where they have some online group things to help keep practicing, or you keep practicing a lot of the exercises and activities that you did in your sessions. You can continue to do them, sort of like any workout. If you get up and you do stretches in the morning, it's the same idea. You're still doing exercises for your voice. It's like brushing your teeth. You have to brush it twice a day. You may need to do your vocal exercises first thing in the morning and maybe later on in the afternoon. So it's a very, they're both well-documented treatments for Parkinson's disease.
Okay, thanks. I can't imagine what it sounds like at your office some days.
My very first client, because I work with a bunch of psychologists in my office as well, and my very first client, I had him doing ah, and I heard a little girl, because we had a child psychologist in our office, and a little girl in the waiting room went ah. So I was like, okay, well, everybody's doing it.
Betty singing.
Yep.
Okay, one of the other questions is, has there been any research regarding the specific maintenance needs of professional voice users, singers or teachers, and do they differ from people with Parkinson's?
Okay, that's a very interesting question. When it comes to, because I'm not a voice expert, I don't actually work with a lot of singers and teachers, but what they're doing would be different, because you're having to do a lot of vocal hygiene with that population. They're having to do a lot more caring for their voice, because they're talking for long periods of time. If they're performing nightly, daily, practicing as well. The intensity for singers and teachers is much more throughout their regular day, whereas somebody with Parkinson's disease, they may not have to have that same amount of effort all day long. So when it comes to professional voice users, a lot of it comes down to vocal hygiene, and doing their warm-ups and their cool downs, as well as, trying to think of what the word would be, using alternate means as well. Sometimes using a voice amplifier. So for teachers in a school system, if you've got a big classroom and you're feeling like you're having to shout all the time, they should have an FM system of some sort where the teacher is mic'd and the kids can hear it wherever they are at the same level. Same thing for singers. It's going to be singers get a lot of problems. And for them, some of their voice issues tend to be those nodules on their throat that need to be removed and then rehabbed with vocal rest, et cetera, et cetera. So quite different from treating someone with Parkinson's disease who have specifically what we call hypokinetic dysarthria, which is a weakness in movement of their lungs, movement of their vocal cords, things like that. So it's a specific type of dysarthria, where for teachers and singers, they don't have a dysarthria. They're not dealing with a disorder. They're just dealing with a lot of overuse. So kind of different.
Okay, thanks. And someone is wondering, is there something that people with Parkinson's can do proactively? So if they're not having any challenges with their voice or swallowing right now, is there something that they can do just to be proactive?
Yeah, I mean, the best practice for talking is talking. So it's important to stay engaged, to keep conversations going with people, to not socially isolate, because I think sometimes what happens to people is if they're not talking, they don't realize that they're deteriorating because they're not engaging with other people. So it's really important to be engaging, to have conversations with people, to maintain that ability to speak. It's also, when it comes to swallowing, there are exercises that are good for people, not just with Parkinson's disease, but just with natural aging. Our muscles tend to get weaker. It's the same thing. If you don't strengthen your arms and your legs, those will get weak as well. So we've got so many muscles in our jaw and in our throats that there are some exercises that people can do to sort of strengthen those in general. There's like doing something called a hard swallow, where you imagine having a golf ball in your mouth and you try and swallow that down. So it's a really tight, which tenses all of the throat muscles at the front. You can do a towel tuck maneuver where you roll up a towel and you stick it under your neck and you do that hard swallow as well, because that does strengthen some more of the back area muscles and things. To strengthen your tongue muscle, to get it so that it's moving to the back of your throat, to create good air pressure, to get food going where it needs to. Something simple about saying a word that ends with K. So often we say hawk, 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 to try and get that movement going. There's something called the Masako maneuver, which actually removes the tongue from the equation of swallowing and forces the back wall of the throat to move. So you put your tongue between your teeth and you swallow. So it moves that back wall. So if you've got the tongue going backwards and the back wall coming forwards, you're starting to create better air pressure to try and get food going the right way. Another really good exercise for people who don't have neck issues and things would be, it's called the shaker exercise or shakir. And it's you lie horizontally and sort of do a chin up looking at your toes, and you hold it for 1 second. Or you can look at your toes like the chin sit up and hold it for 30 seconds. And that engages all of the muscles in your neck. But it's not a great one if you have neck issues or have difficulty lying on your back. So it's kind of something that you can't always do, but it's worth a shot if you feel like you're able to do it. So that those are some exercises for swallowing that kind of help all the muscles that we need that benefit swallowing, and we can use them even as we age naturally.
Okay. And then there's 2 questions, both kind of about swallowing. So someone is saying their spouse has Parkinson's plus, and he chokes very often when eating and swallowing liquids. So is there anything that can help, that the care partner can do to help when choking?
Mm-hmm. One thing to do is, if this is becoming more frequent, it would be worth getting a referral to an outpatient swallow clinic. So that they can really further assess what's happening by taking a really comprehensive history, perhaps looking at doing something like a modified barium swallow or something to look to see what's actually happening with the swallow, because it's kind of good to know what's causing the coughing. Is it happening before the swallow happens? Is it happening during the swallow? Is it occurring after the swallow? So one of our big concerns with swallowing is what we call aspiration, which is where food or fluid gets to the vocal cords and goes between them and goes into the lungs. Now, we can't tell aspiration just by looking at a person, but we can tell that food and fluid is possibly going the wrong way because of a cough. So a cough is a good thing. A cough means that you're trying to clear what is there. So what you should do is encourage them to keep coughing till they feel like the item is cleared. Some people used to say, pat them on the back. That's not a great idea, because sometimes if you pat someone in the back, they suddenly go, and then they breathe in whatever was sitting on the level of their vocal cords. And so you don't want that to happen. So honestly, the best thing to do is to get assessed for that, because perhaps by changing a few things with the diet or giving a few strategies, that might help decrease the choking that's happening or that coughing that seems to happen, rather than just kind of keeping your fingers crossed and hoping that, oh, well, it's not as bad today. It's best to find out what consistencies is he coughing on, and can we modify them slightly to make it easier. If it's, say, hard, crumbly, dry food that it's happening with, perhaps adding a little more gravy or something like that, something to make it a little bit more cohesive may make it easier. But if he's coughing because there's residue that sits in the throat, that may not be the best idea, because more residue might be building and spilling over into an open airway when no swallow is happening. So it's sort of best to have a referral from a doctor. You just need a referral from your doctor to one of the outpatient swallow clinics. I know we have 2 in Calgary. I'm not sure what Edmonton has, but I'm sure that they must have some outpatient swallow clinics to get a full evaluation done to find out what's happening and the best strategies to help.
Okay, and then kind of on a note related to that, there's a thickening solution that some folks have used. What does that do, and would you recommend using that?
Okay, again, really good question. There are different thickening agents that can help to thicken fluid. Again, it's best to do it under the guidance of the swallowing experts, mainly because for some people, thickening things isn't actually better. For some, it's exactly that. If you don't have really good air pressures forcing fluid down the right way or food down the right way, if it's fairly weak and you've given something that's too thick, it sort of hangs out there for a while and clings to the inside of the throat and builds until eventually can fall over into an open airway. So for some, that's not the best solution. For some, thickening it a little bit to, say, a nectar consistency, sort of like a V8 juice type of consistency, so a little bit more viscous, maybe all they need to try and help the fluids go down the right way. But again, it's sort of like you need to be assessed to see what works. For some people, it's actually assessing them on X-ray to see if you have thin fluids. And it also depends. Some people are much better off with thin fluids, even though they cough sometimes. But if they have like water or clear coffee or clear tea, if it does go the wrong way, it's not as bad. But if you put milk and sugar in your coffee or tea, or you're drinking pop and it's going the wrong way, that's where you're more likely to get a possibility of having a bacterial infection that could lead to, upper respiratory illness or a pneumonia or something like that. So again, a thickening agent isn't something that you just kind of go out and be like, well, let's try it out and see what happens. It's much better to be assessed for it and then say, you know what, you do better on nectar. This is how much you would use to get that consistency, show you what the consistency would be. Not most people do really well on really thick consistency, and not most people enjoy it either. It's like that pudding consistency is really, they're finding too thick for a lot of people. So yeah, kind of a proper assessment is what's needed for that.
Okay. And then the next question, it sounds like it's someone who has attended your speech and swallowing course with Alberta Healthy Living. And so they said in that presentation, you mentioned EMST. Is that something for everyone with Parkinson's, or do you need special training before using the device?
Okay, thank you. Is that Vaughn? I see Vaughn on there who asked that question. You're right, I've got it right here. This is what EMST is. So it's expiratory muscle strength training. For anyone who hasn't heard my speeches or anything, you can also just Google EMST and Parkinson's and see what the research has been. It's a spring-loaded device, and what it does is helps strengthen the really deep muscles needed for bearing down and coughing. And how it works is it sort of has this spring-loaded device. So you kind of crank it, tell you when you blow in it, and you're kind of like, and you can't release anything. But then you sort of back it off a bit until you can sort of be, and pop the seal that happens. So this device has been researched at the University of Florida quite extensively with a speech language pathologist called Christine Sapienza. And she has found that it has really benefited a lot of clients with Parkinson's disease, mainly because it helps to strengthen those deep muscles that are used for coughing, because the cough is the best predictor for decreasing the risk of aspiration. So if you have a strong cough, that's why I say coughing is a good thing. If food or fluid's going down the wrong way, Coughing is good because it's trying to clear it, but you need to have a strong cough. So if a cough is like, that's not going to clear what's sitting on the vocal cords. You want a good to try and clear it. That is what this device tries to do, is tries to help strengthen those muscles so that you have a good, strong, voluntary cough. Is it for everybody? No. Partly because if you have undiagnosed hypertension or cardiac issues or any kind of heart problems, and you're not supposed to bear down, this is contraindicated for that. It is one of those things that in the States, it's considered exercise equipment. Health Canada hasn't, I don't even know if Health Canada is even aware of it, but they haven't approved it or not approved it. The company, when I talked to them, said, man, here it's considered exercise equipment like a treadmill. So really, in that sense, anyone could use it, but anytime you use exercise equipment, you sort of need the clearance from your doctor to do that. So it'd be worth a conversation with the doctor. It does come with a protocol that you follow that has, you do it 5 times a day for 5 days or something like that for however many weeks. Are you done with it after that time? They don't know. They're still researching how long you can maintain the benefits from it. So it may have a maintenance program where you have to still do it like for a week every 2 months or something like that. So they don't totally know how well it works for long term, but they do say it's a very powerful device. So it can be very useful for a lot of people with Parkinson's disease, as long as there's not a lot of other issues that are occurring.
Okay, thanks. And then there's a couple questions about soft speech or swallowing issues. So is that caused by the Parkinson's medication or just progression of Parkinson's?
It's sort of a Parkinson's sensory feedback loop that sort of happens when it comes to soft speech. It's sort of not that awareness that it's actually happening. And that's why treatment like LSBT and Speak Out kind of help. Often in that first week, people feel like they're shouting because that is not, they're like so loud, but it's sort of like overriding the system. That's what the treatment sort of does, is it kind of gives you permission and overrides that system. So you have to get used to a more internal feeling. So instead of listening to yourself, it's more of how much effort do you feel you have to make to be able to produce a sound that is at normal volume. So that's kind of why the treatment works so well. When it comes to medications, there aren't any medications that expressly help speech, because they do sort of help everything in general. Speech may benefit from it. But some things like deep brain stimulator may not help speech. It may actually be detrimental for speech. That's why it's important, if you decide to have DBS done, that you talk to the doctor about the risks of what can happen. I've said in my presentations before about having a client who, she had a deep brain stimulator, and when she had it on, she had no tremors in her limbs, but her tongue did weird things too. Her tongue would kind of move and her voice got quiet. And then when you would adjust the stimulator slightly, we had to try and find that balance with her nurse practitioner and stuff to find where's that balance where the tongue kind of calms down and the tremor kind of stops as well. Or do we have a little bit of tremor because speech is a little bit better when there's a touch of a tremor? So it's trying to find that balance between the two, because it can get quite impacted for some people.
Okay. And there's another question here. Does the pneumo vaccine prevent pneumonia if a person with Parkinson's aspirates, or does the vaccine only guard against that type of bacteria? Not sure if you can answer that one. But.
Usually the pneumonia vaccine is for a not for pneumonia caused by food or fluid causing a bacterial infection. So it's usually from a bacterial virus that's kind of going around. So it's not, as far as I know, it's not going to protect you from an aspiration pneumonia, because it's a different type of bacterial colony that's kind of growing and things. So the medication, the antibiotic that they give you for it, will be able to help fight the infection like it would a pneumonia. But the vaccine, I don't believe, and again, as far as I know, I don't believe that it would protect it because they are sort of different types of infections.
Okay. And then going back to swallowing, is there any foods that you would recommend staying away from if a person is having troubles with swallowing, or any foods that you would recommend if they're experiencing difficulty?
So, because what happens in Parkinson's disease when there's tension or tightness that occurs tends to, sometimes the chew becomes a little bit less aggressive. The tongue may not move as well within the mouth to sort of gather food up to put into a bolus. It may be more difficult to handle certain foods that are sticky, like peanut butter, hard-boiled eggs that get kind of pasty, things that are crumbly and crunchy can be a lot harder to manage. So if you're wanting to have a piece of banana bread that's a little bit more crumbly, if you can put a little bit of butter or something on it, just keeps that cohesiveness a little bit more to kind of hold the food together a little bit better. Things that are mixed consistencies where you have a solid and a fluid together, those can be very challenging because if it's like cereal and milk or fruit cocktail and the juice, or soup that has bits in it like minestrone and a broth, you're trying to chew the items, the solid pieces, and get those together in a ball, but while the fluid is sort of running away and perhaps going down into your throat before you're ready to actually initiate a swallow. So that can be a hard consistency to manage. So more like a blended type of consistency, such as, like the Gardener soups that have like butternut squash and a tomato soup or something, where everything is sort of one consistency, tends to be easier to manage. If you like oatmeal, make sure that the milk is stirred in to a consistency that is not too thin, not too thick type of deal. Hard, crunchy vegetables can be really challenging as well. It might take a long time to try and chew and to break down. So maybe better to steam the vegetables instead so that they're a little softer to eat. So mostly softer types of foods are easier to manage. If they've got more kind of substance to them, like gravy or sauce or something to try and hold them together a little better, that can be helpful as well.
Okay. And for liquids, does the temperature of the liquid matter? Is it harder or easier to swallow if it's hot versus cold? Does that make a difference?
Cold can sometimes be the shock that your system needs to try and trigger a swallow. So there's certain things that you can do to kind of help the swallow along, like having something that's cold. So a cold drink, sometimes if it's warm, it may not trigger it as easily, but the cold sort of shocks the body a little bit for it. If it's sour, if it's got, say, a bit of lemon juice or something in it, that sour quality can kind of help swallowing as well. If food has some spice to it, it tends to sort of activate the system a little bit more. So giving flavor, temperature can impact, but it's more just trying to trigger the system to swallow as well.
Okay. And then it's pretty dry in Calgary, and so would a humidifier help with swallowing issues?
Yeah, and that one I don't know. I don't know if there's any research to kind of say that a humidifier would help. I think humidifiers in general just sort of help with our secretions in general. But specifically with swallowing, I don't think it's going to have a significant impact.
Okay. And then one of the other questions is if you have already met and done training with a speech language pathologist and they are giving you homework to do at home, is there any apps that you're aware of that can help kind of measure your volume or kind of help make sure that you're maintaining a certain volume?
Well, if you've been through a program like LSBT, they have even something like a companion that you can do it at home. They have videos and stuff that you can follow along with. Um, the problem with like Apple is great. It has so many apps, but it's sort of an app is there one day and then you check a year later and it's gone. So there's something that I think when you're working with a speech pathologist, they would sort of go through that with you and be like, hey, here's a good one that we could use. Try this one at home. Sound pressure level monitors, which measure your decibels of how loud you are. You can get those apps on there as well, but they will also pick up the environment. So you'll hear the loudness from the street. So you're not sure necessarily, is that my voice or is that the ambient sound that's around me creating that kind of volume? Whereas when we're doing treatment, we have a microphone that we sit right a certain distance from your mouth, and that microphone is embedded with a sound pressure level monitor, and it's measuring that the whole time. So the home version is sort of like that as well, that when you're doing the home version of it, you can see the feedback on the screen of, am I loud enough? Am I maintaining it? But generally, if you've been through the treatment, you'll have that internal calibration too, because you can't walk around with a sound pressure level monitor all the time going, am I loud enough? You want to have it from an internal kind of feeling of effort.
Okay, and then speaking of apps again, is there any apps that can help someone if they're struggling with daily communication or any devices that are available?
There are, again, because it's Apple and there's so many people putting things out there, to investigate sort of text to speech types of apps that are available. Some cost money, some are free, some just even on your iPhone can have that where you can text it and it can speak for you. That would be an option for some people. I have even clients who have had brain injuries who use Predictable, I think it is, and they can type out their message. It has some stuff stored in it, some messages pre-stored, or they can type out what they want to say and it produces it for them. So the bonus is there's many more options out there than there used to be, and they cost fairly minimal compared to in the old days when the cheapest one was about $7,000. So it's kind of nice that there are those apps. Again, look at the reviews. If you're looking at a text-to-speech app, look at the reviews for them. Your speech pathologist may have a recommendation. I haven't had to use it in a while, so I don't know what the latest and greatest of it is.
Okay. And then does music therapy help with speech?
So music therapy is great all around. Singing makes you better at singing. Talking makes you better at talking, kind of deal. If you're able to do the singing without causing sort of discomfort at the level of the vocal cords, that it's good quality when you're singing, then it's great. If you're trying to sing really loudly and it's harsh vocal quality, that's causing damage. But it is great. I mean, just from a mental health perspective, music does a lot for people and is a really good mood booster. So of course, singing can be great. Yeah, for sure. Does it specifically help with speech? It's kind of hard to say. I wouldn't discourage it. I think it's a great thing to do. Is it like the only thing that's going to help you with your speech? Probably not.
Okay. And then you showed one device that you had, the EMST. Do you have any other devices that folks can use if they need help with speech and swallowing?
Well, this one, I talked about the shaker exercise where it was like the head tilt if you're lying down to look at your feet, and how that one is really good for exercising all the throat muscles and neck muscles. But it can be difficult for people who have neck issues or can't lie on their backs or aren't comfortable lying on their backs and doing that. And there's one woman who created a device with her husband, and it's called the Phagiflex or Phagiaflex for dysphagia, which means disordered swallowing. And it's sort of it's plexi, and it sort of provides some resistance this way. And it's holding it under the chin and doing the same idea of looking down, but you can do it in a seated position instead of being horizontal. So that is out there. She does have some of her own data that she's done on her site. She's a speech pathologist out of the US. So it's a possibility if people want to strengthen it but have that difficulty being horizontal. And I believe it's Phagiaflex. So Google that and see what comes up.
Okay. And then we've got another question here. This person is finding when they're talking, they're running out of air towards the end of the sentence. So then the last few words are very difficult to hear. Is there any particular exercises to help with this?
So that is what we kind of call loudness decay, where you start off really strong and then the loudness kind of falls off. That would be a good indicator to go see like a speech language pathologist to sort of work on improving your ability to the intake of air. It's a huge piece of what's done in LSBT. And it's like you build up for it. Same with Speak Out, that you would build up to being able to have those longer phrases and paragraphs and things without losing that air. So a lot of it is, again, some intensity with being able to practice holding for a longer period of time. Like I said, when we do our treatment and you're doing ahs as loud and as long as you can. And so you're trying to, but you want to make sure you're doing with good vocal quality. If it's poor vocal quality, you're doing damage. But if it's good vocal quality, we sort of build on that ability to be loud and longer. And when you're doing it every single day, it sort of carries over that you increase the length of time. If you were only able to hold it for 5 seconds, can we get you to hold it for 10 seconds? Can we get you to hold it for 15 seconds? The average person can hold ah for, I believe, 20 seconds. So, but we find that that diminishes quite significantly with issues like Parkinson's disease, but we can get you to keep improving to get it longer and louder. So there is stuff to do. Can I tell you to do them right now without seeing a professional? Ethically, not really, but it would be a good thing to talk to a speech pathologist about, or to have an assessment, and then you can sort of decide how to treat that.
Okay, thanks. And I think those were all of the questions that we had. I might just give it another minute and see if anybody enters any in the chat, but that's all that we had for today. Okay, I'm not seeing any more, so maybe we'll wrap up here. I know it's a little bit early, but yeah, looks like we're done. So thank you to everyone who joined, and thank you for coming and sharing your expertise. We really appreciate it. And thank you for everyone who submitted questions. We have another webinar coming up, and we hope that you will join us for that. For any information about our upcoming webinars, please visit our website, parkinsonassociation.ca, or follow us on social media. And our webinars are always recorded and added to YouTube, so you can always watch them there afterwards as well. Thanks, Jenny.
Thanks so much, Emma. We'll see you soon.
Bye.
Bye.